I'm one of the 80 million Americans with heart disease. My particular disease is congestive heart failure. My heart simply cannot pump enough blood at the rate my body needs for normal operation. Should my condition worsen, there are only two options for me: a heart transplant or the loss of life as I see it. There are 2,000 heart transplants annually in the United States. 70% of the heart recipients receive a new heart within a year. There is a need for more donor hearts, but the organs aren't available for transplant. Artificial hearts of various designs have been developed since the late 1940s and are commonly used to support life until a suitable donor heart is available. These artificial hearts have been constructed of various materials, the latest having been 3D printed of silicone material. The means of propulsion has been pneumatic, hydraulic, and battery power. The human heart beats at an average of 80 beats per minute, which is 4,800 per hour or 115,200 per day, or over 42 million per year. Note the tremendous number of beats necessary to prolong life just a few years. The recipient of artificial hearts have met with varying degrees of success, but none have reached the levels hoped for. Peter Houghton, an Englishman, had a Jarvik 7 heart installed in 2000 and survived until 2007. The device was designed to support life while waiting for a biological heart. Peter Houghton remains the longest surviving patient with an artificial heart. He did not have a transplant. His thumb-sized mechanical heart was installed without removing the original heart. The cause of Houghton's death was multiple organ failure, but the external battery had to be unplugged from his heart in order for him to be declared dead. The artificial heart had beaten over 290 million times. Most recipients of artificial hearts die from something other than heart failure. An artificial heart has never been implanted in a healthy person. Nevertheless, death is final, regardless of the cause. My father, at age 86, had a faulty valve in his heart replaced with a valve from a pig's heart. This is known as xenotransplantation, the transplanting of organs, tissue, and fluids across species. The major problems encountered were many of the same with transplants within species: organ rejection and transferring disease and viruses. Initially, the first animal donors were apes. Apparently, they appear most human-like and therefore the most logical contributor. However, this was not to be. Primates' hearts were too small and frequently carriers of disease, and they had long gestation periods and rarely delivered more than one offspring at a time. Pigs, on the other hand, have a short gestation period and produce litters of piglets. Also, their hearts are approximately the same size as a human heart. Pigs have been genetically altered to produce piglets that have organs better suited for transplantation into humans. As I mentioned earlier, my father received a valve from a pig's heart in the late 1980s. There was a transplant of a pig's heart into a living human in January of 2022 to 57-year-old David Bennett. Bennett survived for 2 months after the transplant. It is believed that the transplanted pig's heart carried a porcine virus, that is, a virus unique to pigs, which prompted the rejection of the human recipient. In June, 2 brain-dead humans had pigs' hearts implanted. The surgeons that performed this procedure considered it a success because of what they learned from the procedure and monitoring it. With considered experimentation, we should soon have an adequate supply of replacement hearts for those who need them. Maybe even one for me